Hey, everybody, and welcome to the best DPC podcast. I'm your host, Wayne Lowry. I want you to know this is our first episode, but I can already tell you we are the number one DPC related podcast in America. So don't worry, there may be competitors that come up, but as of right now, in this very moment, we are ranked number one. What is this show about? Sure, many of you that are tuning in to this first episode are wondering, what is Wayne going to be talking about and why should we care? We're talking about healthcare in America and how things are rapidly changing. Some of it for the good and some of it for the bad, but things are always evolving and changing. And what we want to do is we want to highlight some of the very best opportunities for people in America to receive the best quality of healthcare. And so we're going to do that by discussing three main things as we go through this podcast. We're going to look at what we consider our core pillars of what we'll be discussing. So the very first thing that I want you to know is that we're going to be showcasing the best DPC practices and cutting edge tools that can help any DPC clinic, whether you're a mom and pop shop and you've got 200 members, or you're a rapidly expanding DPC practice with multiple locations. We're here to try to bring you some resources and tools to help you in your practice. So we're going to be talking to some of the innovators, some of those healthcare providers who maybe they started in traditional healthcare, but they have entered into the world of DPC, and hear about their successes, hear about their challenges, and try to provide you as a listener some insight into what makes a DPC practice successful and good. We're also going to be looking at DPC adjacent services and how they can be integrated into your plan. Maybe you are looking at providing prescription medications, or you're trying to figure out what's a good cash pay referral system. We're going to be bringing those resources to you so that you can understand how those things can be integrated, put into your plan, and hopefully provide better outcomes for your patients. The second reason we're going to have this dialogue, and the second reason for this podcast, frankly, is to disrupt the status quo. Um, Face it, traditional healthcare is broken. Um, we see it all around. We see people that are in the conveyor belt system of traditional healthcare. They come in through the ER for an earache, and next thing you know, they're in $50,000 worth of debt over something that could have been simply resolved with direct primary care. And so we're here to disrupt it, and some of that's going to be making fun of it. We will be trashing, you might say, trashing the competition a little bit, but we're going to have fun in the same time. We're going to have fun in the process. We want to identify the flaws and show the listeners there is a better way. And third, and frankly, third reason why we're going to be doing this podcast and in the format we're gonna be doing it is this. I want to have conversations with interesting people. We could real easily set up a DPC podcast and it'd be like beep boop, bop boop, we are DPC, and nobody wants to listen to that. Like, no one wants to hear a couple of boring people talking about healthcare. Like, seriously, no one cares. No one's going to listen. It could be the greatest information, but unless it's presented with some interest and intrigue, like, we want interesting people with interesting stories. We're not just going to throw up some sponsor and say, hey, we're going to listen to this person because they're paying us a lot of money. Now, if you want to be a sponsor, we will take your money, but I'm not going to promise you that we're going to put you front and center on every podcast. We will talk to interesting people. We want to have interesting stories. So if you're a listener and you say, hey, I've got an interesting story, maybe I'm not a big, well-known physician in this large clinic, but man, I was able to help somebody in a very unique way. Like, send us that information. We want to know. We want to be informed and let our listeners know what opportunities are out there. So, some things that you could expect as we move forward, some things that we're going to be tackling will be things such as how physicians can transition successfully from traditional practices to DPC. And so, we're going to provide experts in that field to help you and inform you and give you the tools and resources so that you can make the shift. We're also going to be looking at technology. I mean, good grief. Like, The script that I'm somewhat looking at right now was helped and edited by ChatGPT. I mean, if you're not using AI in your practice and you're not looking at ways to market or expand with the use of technology, like you're behind. So we want to show you those tools. There's some exciting different. There's many different exciting tools that we can be discussing in this program. Also, number three, something you can expect is how successful DBCs practices are handling scaling and growth. You know, it's real easy when you're a small practice, and maybe that's all you want. Maybe you just want to have a lifestyle business where you are helping your small base of clients. And if that's what you want to do, you be you, boo. Like we're about it. We're going to support you. But if you want to grow, you want to scale, you want to expand your business, but you're seeing a wall in front of you and you don't know how to grow your business, uh, that's okay. And so we're going to try to handle some of those scenarios with you to provide the resources that can be useful. Also, you know, one thing that's really empowering and powerful to me is hearing those success stories with patients. I was one of those success stories. Like literally, I found myself in a dire situation. I had received, uh, excuse me, not received, like it wasn't a gift. I got sick. That cold turned into pneumonia, which turned to double pneumonia, and next thing you knew, I was really struggling. And when I was trying to get a hold of my traditional healthcare provider, they were unavailable. And the best thing they could tell us is go to a night clinic or go to the ER. And that's just not good healthcare. And that's not a good option. So instead, I was introduced to direct primary care, and the rest is history. And I won't bore you with my story. Let me just tell you, folks, like this podcast is not going to be about me. I may be an amazing host and I may ask amazing questions. And frankly, I'm a pretty amazing guy. But this podcast is about you. And we want to bring you into this podcast. We want to bring you into the conversation. At times, we're going to have one guest. At times, we may have three or four guests and have a panel discussion. We want to make this fun and entertaining, but also informative. We want you to tune in every week uh, because you want to, and not because you feel like if you don't endure this podcast, somehow you're not good at DPC. Okay. We want you to have fun. We want this to be fun. We want this to be informative and entertaining, but we want you to come back. We don't want you to dread it. We don't want you to look at it as it hits your podcast and you're like, I guess I got to listen to this podcast because I want to be smart and these people are smart. No, we want you to listen to this podcast because it is good for you and you enjoy it and you're having fun in the process. So, as I wrap up this introductory podcast, I want you to know this is the last time you're going to hear something just about me. Okay. It's about you. It's about our community. So a couple things we want from you. It costs you nothing. We want you to subscribe. Subscribe to the YouTube channel. Subscribe to wherever you listen to your podcast. But also follow us on social media. We've got a LinkedIn page, Best DPC, Facebook, Instagram. Go to our website, bestdpc.com. If you are a clinic, claim your listing or list your clinic. That would go a long way to help us spread the message. We're here for you. We're here for this community. So hopefully you're going to find some value in these conversations. Hopefully you're going to find yourself wanting to come back. So this is it. This is the first pod. I have nothing more to say other than this. Thank you. God bless. See you in the next pod. American healthcare stinks. A maze of red tape and greed that's out of sight. It's time for new choices. A revolution in care, where every heartbeat matters. Cutting through the noise with direct primary